Villagers in Thalang requested that their community and homes are sprayed to prevent the Chikungunya virus carried by mosquitoes, while the Phuket Public Health Office set up a war room to deal with the problem. Suriya Lom-wong-paiboon, a resident in Pa-krong-cheep of Thalang district, showed a red spot on her arm after she recovered from Chikungunya fever. She said 4 of her family members had contracted the fever, leading them to worry that the virus will spread in the village. It is the same for Julie Pirat from another family of the same village who just recovered from the fever and is concerned that the fever will spread to others as they live in a big family with elders and children. Both called for the health office to educate people about preventive measures. They also requested the authority to have the spray to prevent mosquitoes, as they are carriers for the mosquito-borne virus. Meanwhile, on Friday, the Phuket Public Health Office announced a setup of a war room to handle and keep surveillances and control of the H1N1 virus and the Chikungunya fever. Representatives from local governments, hospitals, private or public, health officials and volunteers attended the meeting chaired by the provincial chief medical doctor Pongsawat Ratanasang. They laid out guidelines to educate people using extensive media and volunteers. War room personnel are having meetings every Monday and Thursday to update the situation. A big cleaning day activity will also be arranged in communities to keep clean and clear of sources of mosquitoes. Following the situation, the Katu municipality arranged sprays at schools and community. The Mayor Chayanan Sutikun led health officials and volunteers to educate students about the disease at Ban Katu school. He said at least 5 Chikungunya cases were reported in the Katu municipality. The municipality has been surveying and eradicating sources of mosquitoes covering all 16 communities to actively prevent people from contracting such fevers. Dr. Wiwat Sritam-Manod, the provincial deputy medical chief, earlier talked to Andaman News about chikungunya in Phuket and gave guidelines how to keep away from both viruses.
Because of it, spreading by the mosquitoes in the rubber plant.
What does this chikungunya mean? What does it come from? From mosquitoes, right? But
yes, mosquito is a kind of viral infections, and they have three types. One is in the Asian type. The second is in the between African type and in the middle. So they have 3 different kinds. For the Asian type, we already have in Thailand for many years, but it's not the outbreak because of most of the people have immunity on that, and it's less severity because you can have fever for a couple of days, you have some kind of joint pain and itching, but it's not so serious. But this type of chikungunya is a new strain. It's spreading from Africa to India, Pakistan, and then to Indonesia, Malaysia, and then southern part of Thailand. The major problem is that no one in Thailand had the immunity for it.
But it can be treated again.
It's not serious because of have no any case that have mortalities. But just the problem about the joint pain, have some rash. Usually the joint pain they will be recovered within 1 week.
How different or similar is it to dengue fever?
Different, very much different. Because of dengue fever or dengue hemorrhagic fever, it means that they will have the problem about the bleeding or hemorrhage. This can cause in some case that very few can cause severe bleeding. But this kind of fever, they have no any case that they will have the bleeding tendency. No.
What about then just general advice for the public for both swine flu and mosquito flu? Is it things like keeping clean, covering your mouth?
Very important.
Going to the toilet, even something like basic advice would you give?
For the Mexican flu, because of it can contact by the droplet when we sneezing or we coughing. So it's very important to keep clean due to the tissues or if you have no tissues, you can make a coughing on your throat like this. So it will be safe because otherwise when you coughing to the open air, you can spreading the virus about 2 meters around yourself. So it's very important to do like this. This is the first thing. And then the second thing is that it's also contagious. If we have it on our hand and when we rubbing on the eye or something, it can be contact to us. So wash your hands. Wash your hands at least 20 minutes frequently.
Every 20 minutes?
No. At least 20 minutes. 20 seconds. Sorry, 20 seconds, and try not to rubbing the eye.
Okay. But as for chikungunya, it's a mosquito, but it's not person to person, is it?
About the Mexican flu. Okay, the Mexican flu. One more important thing is that you need to make a mask if you got the coughing or you got the flu, and try to wash the hand before you go to the hospital. Otherwise, you can spreading in the hospital. So it's very important. When you got the fever, do not panic, because most of the case will be very mild. That you will, for the kid, they can running or die, just like normal flu. So don't serious and don't be panic about that.
Right.
For the infection about the chikungunya, only the mosquito. So the best thing is try not to be bitten by the mosquito.
But it's not contagious from one person to another.
No.